My name is Kim Thomas and I'm Professor of Applied Dermatology Research at the Centre of Evidence-Based Dermatology at the University of Nottingham. I'm part of a large collaborative team working at the Centre of Evidence-Based Dermatology, and we're all really interested in understanding how we can better prevent and treat skin disease. Our main areas of interest are in common skin conditions such as eczema, vitiligo, skin cancer, but also in rarer skin conditions that very often don't get investigated. Over the last year, I've been concentrating a lot on a clinical trial of eczema, looking at silk clothing for the management of eczema, and also I'm very involved in a trial of treatments for vitiligo, helping patients to treat their vitiligo better at home using home light devices and topical corticosteroids. We spend a lot of time in trying to establish the most important questions by talking to patients, healthcare professionals and other people involved in managing skin conditions. Obviously I'm delighted to have been shortlisted for this award, particularly so since my nomination came from two of our patient partners that we worked with very closely for many years. They give so freely of their time and efforts into delivering our studies, and I'd just like to say thank you to them too.
Hi, I'm Helen Walker. I'm a senior research nurse for 1 day a week at Lincoln County and also joint colorectal nurse specialist for the rest of the week. My research experience has been within colorectal and stoma care, and I've had the privilege to have partaken in 5 trials, randomised controlled trials. This company provides intimate health products for patients with intimate health needs such as stomas, bowel dysfunction. I recently became top recruiter and first to recruit worldwide. I would like to thank the people and the team members that I work with, because clinically wise I wouldn't have been able to have partaken in these trials without their support, but also for Tanweer for nominating me for this award as well.
I nominated Helen Walker and I'm really proud of her because she's working very hard. She is the chief investigator for 2 multinational and multi-center clinical trials. That's very exciting and very important for us.
This role is very new, but very proud moment, and nice to be recognised for the hard work that we've done over the 6 years of doing these trials.
I'm Jerry McCann. I'm a consultant cardiologist here at Glenfield Hospital in Leicester, and I work in the Department of Cardiovascular Sciences where I'm Professor of Cardiac Imaging. My specialist interest is in cardiac MRI, and I lead my own research programme as well as interacting with a number of colleagues in different disciplines including coronary intervention, electrophysiology, and also working with other colleagues across the trust and university. The thing that's made the real difference for me personally in terms of clinical research was the award of an NIHR research scanner in 2009, which was then put in the following year. And what we've tried to do is make this inclusive so that patients throughout the East Midlands are able to take part in the MRI research studies that we have run. These MRI images let us see the heart in great detail. This is a patient who has a narrow aortic valve due to the valve only having 2 leaflets instead of 3, and this puts extra pressure on the heart muscle, which we can see in this patient's case is functioning normally. When I found out I had been shortlisted as a finalist, I was really chuffed. I think it's a reflection not only on the work that I do, but the whole team of people who work with me in MRI research, including many fellows that have come through the department over the last few years, and the radiographers plus the research team and my colleagues, and we very much work as a team.